Hi, as you can see, this is our pharmacy here. Unlike our colleagues from dermatology, we plastic surgeons use very limited products for our patients, and most of our products are for post-surgical care that we use. Today I'm just going to go through some of my favorite products that I usually kind of explain to our patients for a very smooth post-surgical recovery. One of the most commonly used, and I must say that it's the first thing that I tell all our patients with post-surgical scars, is a sunscreen. Now, I usually prescribe this from Dermatica, that is Barilon. I'm not endorsing it in any way, but I have personally used this as well, and it's a pretty good product. And I always tell our patients that it has to be SPF 50 for post-surgical scars. So sunscreen is one of the most important products that I recommend for our patients, and this will prevent any hyperpigmentation of your scars, any sun damage to the surgical area. Now, along with the sunscreen, I also prescribe some scar creams. Now, these scar creams, there are many different companies. Most commonly I prescribe these two. One is Cicatrix, which is a Spanish product, and then there is Contractubex from Medicare. Now, these two products I usually advise more than what is relevant with regards to the ingredients of it. I ask my patients to massage their scars with these creams, where the keyword is mainly massage. So massaging with some sort of a product is extremely important to make your scars soft and supple. And what I have got feedback from my patients after using these two products have been very encouraging. So I definitely add on a scar massaging cream for all my patients after surgery. So sunscreen and then massaging scar creams. These two things we are done with that. What else? Most of my patients also sometimes complain of itching in the surgical area, especially if we have done a large area of liposuction and they're wearing compression garments all the time. Itching can be there, and in that time I usually prescribe this moisturizing lotion, which needs to apply 3 to 4 times a day. Venusia is what I usually prescribe, which is pretty reasonable in the pricing as well. And this is one of my favorite moisturizing lotions to be used for post-surgical patients for itching and to keep the skin moist and not become too dry and cracked. Other than that, let's go through something else. One of my favorite product also for all the wounds that we create with the incisions or some small infections or some redness in the scars, I usually prescribe mupirocin ointment. Now, mupirocin is an antibacterial topical cream which decreases infection and inflammation in the wound or scar. So I usually prescribe this until the wound is completely healed, and after the wound is healed we go back to our scar creams. So mupirocin ointment is one of the most commonly used ointments that I use for all the wounds. Previously people used to use Neosporin ointment. Now I don't like to use that because that has 3 antibiotics and we are unnecessarily causing resistance. So that's why I use a single antibiotic, that is a mupirocin ointment. Other than this, the last product for today is probably Sika Care silicone gel sheet. All scars, when somebody is really picky about their scars, if you want to give all your best to improve your scars, I also advise this. This is from Smith & Nephew. So these silicone gel sheets provides scar improvement, scar maturation by realigning the collagen in the skin. So I prescribe this to be worn or stuck to the scar as much as possible. Usually people who go out to work are not able to do that, so I tell them at least when they are at home and during the night time they need to stick this. It is a multi-use kind of a silicone gel sheet. They can peel it off, wash it and use it again. and I usually prescribe this for about 3 to 6 months after a surgical procedure. So that's about all my favorite products today. We'll come back with more videos next time. Bye bye.